Welcome to Safety and Health Among Older Construction Workers in the United States. This webinar is the last of our construction series in partnership with CREAMSD and BC Construction Safety Alliance. We're happy you're able to join us. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you might be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You will be emailed the direct links for all of these items when they're available. Today's webinar will be co-moderated by Dr. Catherine Brookman, Associate Director, Knowledge Transfer and Exchange at the Center of Research Expertise for the Prevention of Musculoskeletal Disorders. Catherine will be moderating our Q&A session, and we'll let her introduce herself, and Dr. Sue Dong will be our presenter.
Thank you so much, Yusra. Good afternoon, everyone, and welcome on this beautiful first day of spring. On behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CREAMSD as we are more commonly known, we'd like to thank Yusra, Work Wellness and Disability Prevention Institute, for the opportunity to partner with them on this construction series. We'd also like to thank the Ministry of Labour for our funding, which supports the delivery of these webinars for CREAMSD, and of course, thank our presenters who provide their expertise. It's my pleasure to introduce to you today Sue Dong. Sue is Data Center Director for the Center of Construction Research and Training located in Silver Spring, Maryland. She has conducted occupational safety and health research focusing on the construction industry. She is the author of numerous publications, including articles related to back pain in the workplace. Currently, Sue serves as the principal investigator for 3 projects funded by the U.S. National Institute for Occupational Safety and Health. She has a doctorate degree in public health and a master's degree in economics. Thank you so much, Sue, for agreeing to present to us today, and I now hand this webinar over to you.
Thank you, Catherine, for your nice introduction, and thanks all everyone who enjoyed our webinar. I also thank the opportunity to share our research findings on construction workers in the United States. Before I start my presentation, I'd like to briefly tell you what CPW is in case you don't know that. The CPW has done construction safety and health research and training in the last 3 decades. We are funded by, we're nonprofit, we're funded by US NIH and several other federal government agencies. This study was funded by NIH, but the contents of this presentation are solely the responsibility of the author and do not necessarily represent the official views of NIH. You know, we are required to include disclosures in our presentations. My presentation will cover several issues to help you easily follow up. I divided my presentation in 6 sections, including the aging workforce trends in the United States, and the fatal and non-fatal injuries among construction workers, and the age difference, health status and medical costs. Following this, I would also talk about how the health status and conditions limit individuals' work ability. And when we talk about work abilities, we have to consider what kind of a job they are doing. So, and then I will talk about job requirements in the construction industry and the reality of older workers, of their workability, what they can do according to the requirements. And finally, I will have a brief conclusion and discussion. So I'd like to use this cover of the magazine for several years ago, but still that's the truth. Aging workforce trends in the United States. Typically, construction workers were younger than the average of labor force. But that may not be the case anymore. In the 2017, the average age of construction workers jumped 6.4 years compared it was in 1986, even exceeding the average age of all U.S. workers. By detailed construction occupations, you can see some occupations like a truck driver, managers, and so there are more than 1/3 of workers who are aged 55 years or older. You know, we have different definitions of what old is. But I agree, I think everyone here would agree. People who are aged 55 or older are not young anymore. So in 2017, overall, 1 of 5 construction workers in the U.S. were 55 years or older. This situation may continue because baby boomers are more likely to work longer than their previous generations. These are we found this using the longitudinal surveys for all these the recent cohort. EBB means early baby boomers, MBB means the middle age boomers or younger baby boomers, and all of these plan to work much longer than their previous generations. This is not only for some white-collar workers, it's also for workers who are in construction trades. So for all these categories, the younger generations plan to work much longer, even after full-time after they reach age 65. That's not a surprise. The projection to 2006 to 2026 show that the proportion of older workers will continue to increase. Probably you would think there's baby boomers as a big contributor to aging workforce. And then after the baby boomers get rid of the labor force, the situation might be different. But this projected data show you that the gray workers will be common even in the to 2060. So which means that people can see the green hair in job market, not only in our generation, they will see that in the future. You might want to know why workers continue working. Our findings and many other existing research show many reasons, but the first important, financial needs. We work. Why we work? We need money. So several reasons people have to work to support themselves. Recession and the social security reforms, the pensions switched from defined benefit to defined contribution. Defined benefit, I think probably you know what is a defined benefit. That means your employer will contribute and give you such kind of pension when you retire based on your service years and your wage and salary level. The defined contribution is something like the 401k in the US. That is a defined contribution. You contribute your own and your employer may or may not match. Another important reason is age increase for full Social Security benefits. I think this not only in the United States, maybe also in other countries, such in some European countries. Well, you may want to work longer because you like. People think the positive health benefit from physical and mental activities or some positive social connections, and you feel happy when you have some high achievement. So whatever people are willing or unwilling to work, we want to know whether they can do as they want. Now, in the following, I want to share this with you. And when the older workers continue to work, what could be the consequences? The fatal and the non-fatal injuries on the job site. This bar chart shows very clearly the rate of fatal injuries for workers aged 55 and older was almost double the rate, or more than double the rate for workers under age 35. You can see this not only for construction, but for all industries. In construction, probably you know, the fall injuries is the #1 killers. This slide showed the risk of fatal falls is particularly high for older workers. Similar patterns was found for the fatal struck by injuries. It's also increased by age. Even we found the younger workers, the youngest group, also had a higher risk of a fatal struck by. Risk of a fatal caught in between injuries were also increased when workers were getting older. All these three combined, in this chart, you show that falls struck by caught in between these three cause recognized by the US OSHA as 3 of the construction Fox 4. Except executions, older workers have the higher risk for all the 3 these kind of injuries, the fatal injuries. For the non-fatal injuries, this combined all this falls to lower level, falls on the same level, and slips, trips without fall. Probably you notice that the proportion of falls on same level increased with age. Do you know why? Or you can give a explanation? I think that because the older workers are more likely to keep the balance control. Older workers are also more likely to have musculoskeletal disorders, sprains, strains, tears, soreness, pain, and fractures. All this increased with age. On the other hand, older workers are more likely to have a back, shoulder, and knees affected by injury and illness, but are less likely to have head and hand affected. Why? Possible. Older workers have more experience. They know how to protect their head and hand. The older workers also need longer recovery periods if they are injured. You can look at this, the older ones, and look at the younger groups. Their recovery periods almost more than tripled than the younger ones needed. Now we just talk about the worker-related fatal and non-fatal injuries. Now, in the everyday life, how worker reported or consider their own health status and how much that cost if they have problems. Hearing. This chart shows this, compares construction and all industries and by age group. When they were younger, looks like very similar. Construction workers and workers in all other industries are similar. And when they're getting older, you can see the difference, the gap start to widen. What caused this? I think that probably because of the job exposure, the noise on job site in the construction industry. And then when construction workers are getting older, they are more likely to have hearing problems. Trouble seeing, that's common. When people are getting older, it's more difficult for them to see clearly. But we cannot see much difference between the all industry, at least not in the trend between construction workers and all industries, which means seeing looks like less likely to be affected by their job. When people or workers are more difficult to hear and see clearly, you can imagine the risk on job site would increase. This comes some of the health indicators. You know that a lot of people have diabetes or sugar diabetes. The question from this survey is, have you ever been told by a doctor or health professional that you have a diabetes or sugar diabetes? There's a clear pattern. When people are getting older, the proportion of the problem increase. Similar patterns for hypertension and high blood pressure. Older workers are more likely to have such problems. Obesity. You know that's the close link between obesity and health of other health outcomes. This data shows U.S. workers become heavier year by year. For this, please notice I changed the measure. Instead of use obesity, I used healthy weight because although many people are overweight, some people, for whatever reasons, are underweight. So I think the healthy weight could be a nice measure to say where is the problem. So if you look at this, for both construction workers and workers in all industries, people are getting heavier after they are getting older. So it looks like the situation somewhat reverse when they're after 65 years or older. What happened? Probably after they retire and they or partly retired, or they start to have a problem and they start to pay more attention to their weight. It's hard to tell just based on this slide, and more research is needed to find out why. We know the relationship between cigarette smoking and health outcomes. The good news is the prevalence of cigarette smokers in construction and in all U.S. industries getting declined, and even construction workers are still more likely to be current cigarette smokers. By age group, the older workers are more likely to be former cigarette smokers, but less likely to be current smokers. So which means a lot of older workers already quit, but the young workers started to smoke. This slide shows the cost of all the health expenditures increase with age. This only measured the medical cost. This shows both total medical cost and out-of-the-pocket expenditures, which means in addition to you paid by your insurance or paid by Medicare, Medicaid, you still have to pay some money from your own pocket. However, age is not only the factor to determine the amount of medical cost. Actually, the health conditions, the health status, for those who have the poor health, this just measures the baby boomers. They have their health expenditures, also out-of-pocket expenditures, that still means these medical expenditures, almost tripled than those who were in accident and a very good health, even they are in the same age group. Now we look at all the health conditions among the older construction workers. So how their health affect their work ability or their work. This is from a different data source. I copied the chart directly from the SAS output, so that the colors are somewhat different. So for those who had the poor health, you say there's more than half, or 51%, that reported their health limited their work. But for those who had excellent health, so only 2% reported their health limited their work. Older people are more likely to have chronic conditions. Looks like this chart shows you the different conditions may contribute differently or affect differently work limitations. So the lung disease ranked #1. That largely affect workers' workability. And for these other diseases, relative lower and less affected. The health limited worker and also varied largely by number of conditions. For those without condition or without they reported no any effect. For those who have the multiple conditions, their work health largely limited their work. Their work means the paid job. This changes, this shows how these work limitations changed over time. This only measured among the workers who reported their longest job was in the construction trades. Say when they were younger, when they are getting older, the change is so big over time. Even for those, the previous chart showed longest job may also include those who already retired. But for this chart, shows those who are still working, either full-time or part-time job. But there's a big difference among the age groups. When they reported that they have the limitations, this survey also asked what kind of a limitation they have, what kind of problem they have. This I only give examples because the measures have a lot of details. This arms up, climb stairs, and lift 10 pounds. So where is the problem? Climb stairs. Looks like this is a big problem among the older workers. Well, now, when people reported they have such problems, and that maybe depends on what kind of job they have. They may be fine if they have a different job, even they have some limitations. But it may be a big problem if they have certain jobs, particular physical demand jobs. The earlier chart show you fall injury is a big killer and bigger problem in the construction industry. This, I just pick up this, a couple of job requirements, see how many construction workers by the occupation are required to working at the heights on the job. So, like the elevator installer, roofers, they may have to work as a 100% of the time on the job site. But this is more detail. The climbing ladders, scaffolds, or poles at the work. The painters, sheet metals, all these have to climb this very frequently. So this I combined more than one measures for those typically these job activities in construction site like reaching, the lifting, pushing, climbing, stooping, kneeling, crouching, and heavy vibration and high place. And develop an index measure and then by the construction occupations. You can see the different, but the construction manager, the relative have the scores relative lower. For this, combined the two different data sources and two different measures. So the combined physical abilities by age and physical requirements by occupation and together look at this, you can see very clearly this the difference among the age group, the ability, whether they can full performance their job or not. For these managers or professionals, when they were at age 50 to 54, this is about less than 40%. But when they're getting older, the proportions decrease, but still looks like even they are very old, they are still able to do something. But for construction trades, when they were this age group, about 1/3, and job till when they're getting very old, almost they can do anything in construction trades. So this raises a lot of questions, because this when people are able to do something, but still they are able to do something else. So let's say that will show in the conclusion and the discussion, if you see if you agree with me or not. All the slides already show you the higher prevalence of chronic conditions that's common among older workers, and a higher fatality rates and a higher non-fatal rates for certain injuries. And older workers need longer time to recover if they are injured. And also, older workers usually need more medical treatment, and also higher medical costs. However, the data show that age is less of a factor in healthcare costs and health conditions and health status, and actually that's major determinants. So we see that workability decreases significantly with age and is determined by health status and chronic conditions. On the other hand, you already say that construction jobs have a higher level of physical requirements. The differentials between workability of older workers and the job requirements should be taken into account when we're defining workability and the workplace intervention programs. So, which like roofers, they are unable to do work as roofers. They may be able to do something else. Because of this, job redesign and retraining should be available for older workers to sustain their employability in construction, maybe in other physical demanding industry as well. And promoting healthy aging for workers is essential in the construction industry and also in all industry in other industries, not only in the United States, maybe in everywhere. With appropriate management, the value of older workers will overcome the negative effects of aging. I don't have to talk what is the value of older workers. If you have older workers in your organization, I believe you will know the value of what they have. Here's a long list of the data sources I used to develop these slides in the American Community Survey, and the ACS is a household survey and has a very large sample size. Every year, about 3.5 million households were contacted to collect such information. And the information collected including the workers' employment, demographics. So this is a very good data source to measure these demographics and the job. And so particularly for the small subgroup and the small geographical areas because the large sample size. The SafeWay data, census of fatal occupational injuries. Since the census, that's not a survey, which is expected to cover all the work-related fatal injuries in the United States. The data collected include worker demographics and the case of the injuries and the environment of the when the injury occurred. Current population survey, that's a monthly survey and a joint conducted by U.S. Census Bureau and the Bureau of Labor Statistics. Every month, about 60,000 households were contacted to collect information. This include the employment information, demographic information, and some similar information as collected in ACS, even more than collected in ACS. Employment projections, I did use the data for several charts that show this even to 2060 and what would be the labor participant rate among the different age groups. Health and Retirement Study, or HRS. HRS is a longitudinal survey conducted by the University of Michigan since 1992. So the size graphic charts were from this survey that show all the changes because of the aging process. That's a longitudinal survey. Those cohorts were followed year by year when they reported very similar things at age 50 and age 55, age 60, age 65, and older. So that is a good data source to measure this process of aging process and how the aging process affect individuals' health and their workability. Medical expenditure panel survey. Some slides, the measured medical cost was from this survey. This is a very useful data source because it includes a set of large-scale surveys of families and individuals, their medical providers, and their employers. So for all these data collections is often used to measure health conditions and the cost and the use of health care and health insurance coverage. National Health Interview Survey. And actually, MAPS and NHIS share the same cohort. So these two surveys can be linked together to answer some of your research questions. The NHIS basically provides the information on these health conditions for the very detailed and some health behaviors like smoking, like weight, etc. Both of these, I forgot to tell you the sample size for the HRS that has more than 20,000, include more than 20,000 people who's age 50 and older in the US. The MAPS and the NHIS, MAPS are a little bit smaller because they reselected from this NHIS sample. NHIS includes 35,000 households and about nearly 90,000 or more than 80,000 individuals. The ONET, if you go to the website, it's very easy to find. That's occupational information on the website. This is not designed for occupational safety and health measures. They just provide the information. This developed under the sponsorship of the U.S. Department of Labor, Employment and Training Administration. It provides information on hundreds or 900 something occupations and help people, particularly for those new graduates or the job seekers, help them to understand today's the work in the United States. And so they collect data from both business and workers. Occupational Requirements Survey, or the ORS, is a relatively new survey conducted by U.S. Bureau of Labor Statistics. It's interesting that this survey is sponsored by the U.S. Social Security Administration, because they want to use the data to measure disability. So even some information is a kind of overlap in the ONET and the ORS, the purpose of the data collection is quite different. So the ORS has a more detailed measure about the physical ability, mental ability to meet the employer's specific job requirements. The final data source I listed here, that's a survey of occupational injuries and illnesses. So this is the major data collection to measure non-fatal injuries and illness in the United States. This survey is collect data from employers, and employers are required to keep a log and as a record required by the U.S. OSHA. So that is all the data sources I used to develop my slides. I skipped something when I copied some of the findings we already published. I believe in the future you will have you are able to get these slides. If you click that link, you are able to get the original, either that data source or either that the articles. And thanks for your listening. I think that we should have enough time for our Q&A.
Thank you so much, Sue. Your timing was excellent. You have provided us with a very rich database presentation. And I see that we have some questions coming up related to training. So one of the questions is, do we know anything about the health and safety training of these different cohorts?
You mean by age?
Yes, by age.
Oh, yeah. So as far as I know, so CPWR works with the building trades. They design some specific training for the older workers. Yeah, because my work here, I focus on the research and the data, but I know our training department has some specific program for older workers, and something like how to prevent the MSDs. And so, yeah, I think we do have. If you need this information, so either you can go to CPW website to download some of our existing programs, or you send me email, I can forward you some linkage.
Thank you for that, Sue. And I think one of the considerations related to training was that, was there something different or not included in the training for older workers, and as such, was that related to some of the findings? So rather than looking at each distinctly, looking for some connections between, what is happening with the training of older workers. Is there things that are different, or do we need to include different things? So that's something you didn't address, and maybe it's something that could be addressed and connected to in a future webinar.
Yeah, I hope I understand your questions or the audience questions regarding the training. So as I mentioned that I am not an expert in training, but the information I provided here today did give some some ideas and to the training programs. So for the more detail, because one of the survey data source I used included in my presentation, that like ORS, that's very brand new. Right now, they only provide the very general information, and they will release more details. After that detailed information is available, I will share my findings with our training department and those who are responsible for the training programs, and say whether that can contribute to the program, the training program redesign, and based on the different occupation and the different needs of the age groups.
Okay, thank you, Sue. And we also had a question related to the retraining or career change programs being implemented in the workplace, whether they were successful or not. And it sounds like that kind of detail would be included in the references that you could provide.
Included the reference about the how their job affect their health, you mean?
In just if there's in the training studies,
so in the training how
department,
the training will contribute to the workers' health and how to conduct the training for older workers.
Yes, and you know, if that retraining or career change program, you know, what were their programs implemented for retraining?
As I said, this I think that should be the right way, right thing to do. But I heard that some programs already started, like when they are able to perform certain job activities in one program, in one occupation, whether that employer can switch them to the different occupation. I think that need very close relation or close collaboration between the employers, between the management and the workers' sides, and the training program. So I'd like to mention one thing, that the CPWR, I don't know if you know that or not, but there's a Dodge data and analytics. That is a big company that provides the construction data. And now CPWR and Dodge works together to conduct a survey. In that survey, we did collect some information, like whether they have specific concerns when they provide training programs. We did have trying to collect information about that. So I think this need to not specifically from right now from the data sources I can get, we cannot tell in the real work science, in the real world, how many employers and how many work science are ready to do that. But I believe that should be a right thing to do. We already know that this many employers in construction already complained that labor shortage and a skill shortage. They do want to remain the older workers, but how? That's the question.
Thank you, Sue. And I'm going to jump into another question that distinguishes construction workers. So the question here is, are the statistics the same? Are you aware if there's a difference in the statistics for construction workers working in municipalities versus the overall construction workers?
Yes. So basically, CPWR focuses on construction safety and health. And most of my slides here and the data on construction workers. obviously. But some slides I just do the comparison, like all industries and the construction industry. For all industries, that include construction. Construction accounted about 6% of the overall U.S. labor force, and that for the comparison purpose, construction is included in all industries in some of the slides. So, but for other slides, I based on because this, I think for those you may not know these categories and the data sources very well. It's kind of a little bit confusing because the different data sources use the different measures, like even the categories of occupations can be quite different. So that's why some I use the relative details, some I use the more general. For those, I think it's I may go back to show on the screen, show you what is what on the screen. Let's go back some slides. So for this, that is for the just based on the cohort of that survey. That's a longitudinal survey. I talked about that survey at the end of my presentation. So this by cohort, that's including all this who were in that cohort. And then the following chart that separate construction trades and management trade, manager occupation. And show you more. This still separate construction and all industry. Construction that's based on the NAICS codes. Here's based on NAICS codes. The similar thing for this, that's only for construction. Yeah, that confused this for relative detail. This only for construction. These three, the only construction. Here, I just want to mention I want to show this, show the on the bottom. So if you click this, that we reported these slides in our quarterly data report. If you click the link, you can see the entire quarterly data report that have the information on the data sources we use and the measures we use, and so that probably you will be clear that after you read that entire report. So this from the one report, this from another report, that's all this from our quarterly data report. We publish such a report every quarter and summarize the recent findings.
We also had another question related to if there was any breakdown for workers in precarious employment, that is, workers in the construction who are temporary, casual, or part-time.
Yeah, that's a really good question. We have studies on the like temporary workers and those like non-standard work arrangements. We do have a study on that. Unfortunately, the data collecting that information and does not collect information on any health measures or injuries or health status, and the sample size is small when we break down by detailed employment group, like those who were from temporary agencies and those who were from like contingent workers. Yeah, so we did have studies on that, but not linked to the aging. I think that's it's a very good question that just give me some idea to do further. You know, now they call them bridge employment, which means between their full-time working and retirement, whether workers can do something alternatively as a bridge. So that needs further research on that.
Thank you. Thank you very much for raising that. We have no more questions at this point. If other questions come up after the webinar, I'm sure Yusra will email them to us. I'd like to take this opportunity to thank you for such a comprehensive, excellent data and resource-based presentation. So we really appreciate it. It's given us a lot of food for thought. And I know certainly from CREAMSD, we will look at how this compares to what we're experiencing here in Ontario.
Thank you, Catherine, and thanks everyone who participated in the webinar. I believe you have a lot of questions because some research questions, and you raised that, we haven't got answers yet. We'll continue to work on that. So if you have questions, I have the email list here, and you can either contact me or send your question to Catherine, and then maybe we can continue our discussion in the future. So I also list the CPWR's website here. If you are interested in our products and our programs, please visit cpwr.com.
Thank you very much. And Yusra, thank you to you and WWDPI for hosting these webinars. I'm sad that today is our last construction series webinar. I know that they have been extremely well received and have benefited all of us, especially looking at the opportunity for future research.
That's a good opportunity to share some findings with the audience, and also the good questions, and inspired us to do further research and provide better information to occupational safety and health. Thanks.
Thank you, Dr. Sudong, for sharing your valuable insights, expertise, and research results. Very comprehensive data regarding the safety and health of older construction workers. And Catherine, as always, it's a bit of a nostalgic moment since it's our last webinar of our construction series. Thank you for the tremendous efforts put into the construction series, for co-moderating this webinar and bringing your positive energy to it. It was certainly a great adventure. A special thank you to our audience